we have got some exciting things you'll want to learn about a little bit later on the show, so stick around. Now, we have a special guest with us on a topic that I want you to know more about. I want you to take ownership of this. If you're up on top of this, you're going to benefit by it, and so is your family. I've flown halfway around the world to hear this speaker speak on this topic. And you might say to yourself, well, Dr. Bob, you're not a dentist, so why does this interest you as it relates to this? Because our special guest is a doctor of dental surgery. He's a dentist. And why does this interest you, Dr. Bob? Well, I found out, because I didn't learn about this in school, that the oral cavity, your mouth, is a gateway to a whole lot of issues related to your health, your general health. And if your oral cavity is not in good working order, or you have these low-grade simmering infections rolling in your mouth, it can impact you on a cellular level everywhere. And that became interesting to me. And since then, I know it's a big part of my own personal health and my family's, and I want you to know more about it. So we've asked a special guest to join us. His name is Dr. Chris Kammer, and he has been a progressive voice in dentistry for more than 2 decades, seeking out emerging technologies and approaches. His work with the oral systemic approach, a recent movement in medicine and dentistry that improves general health by optimizing oral health, has helped many of his patients gain increased resistance to chronic disease, including diseases that we all hear about, but yet we don't relate it to the oral cavity, to our mouths: heart disease, increased risk of stroke, diabetes, some types of cancer, even Alzheimer's disease, as well as preterm births, women having births too soon, or even obesity, all related to the oral cavity. Dr. Kammer works to alert all of his patients, but especially the kids, to brush, rinse, chew, and smile when it comes to xylitol, oral care products, and improved dental and overall health. And with that, let us welcome Dr. Chris Kammer to the Dr. Bob Martin Show. Good day to you, Dr. Kammer.
Hello, Dr. Bob. Good to be here.
We're so happy to have you on the show again. Let's begin and jump right in there with that introduction. What got you into the world of oral systemic dentistry as opposed to what most dentists learn, and that's drill and fill only?
Right. And then there's also been a huge movement in dentistry for cosmetic dentistry. In fact, my father founded the American Academy of Cosmetic Dentistry. I was one of the founding members as well, and we were making beautiful smiles. But at one point, Dr. Bob, I got so tired of seeing bleeding gums. It seemed like something that just wasn't going to go away. And I started to dive into it, saying, we've got to be able to do something with that, to improve people's health, get them healthier. That it's got to be a problem. And so the more I learned about it, the more I was shocked about what's going on behind the curtain of the oral health. For example, whoever thought in dentistry we would ever be talking about life and death? But this discussion is long overdue. I don't know if you recall, but Time magazine had a cover story a few years ago about chronic inflammation. And the headline cover story was called "The Secret Killer That Can Lead to Heart Attacks, Colon Cancer, and Other Diseases." And this secret killer is inflammation. Well, Dr. Bob, the number one source of chronic inflammation of the entire body is gum disease. And it's time to finally put the dental team on that critical care medical team, because we can help people not only have healthier mouths, but healthier bodies.
Okay,
so it's kind of...
Yeah, given this information is well known now, do you see an ever-increasing level of referral from medical providers who have, let's say, cardiovascular challenged patients in their office? Are you seeing in your practice a referral slip coming from, let's say, a cardiologist or an internist of their patients saying, look, I can help you cardiologically, but we first have to clear up the oral cavity, the infections you have in your mouth, because if that's not happening, we are banging our head against the wall.
Right. If the dentist needs to be a critical component of the healthcare process with the medical team. And no, I'm not seeing a lot of that. it has mostly started with independent physicians. In fact, one of the previous presidents of the American Academy of Private Physicians basically came out and said, physicians can't improve vascular inflammation often without identifying and treating existing high-risk oral bacteria. Well, only dentists are doing that, and their hygiene teams. So it's really like they're leaving one very, very important piece of the picture out. So physicians can't do the best they would like to do to reduce the risk of their patients for heart disease and stroke and a whole host of other diseases without the dental help.
Mm-hmm. Well, and our listeners might be scratching their head going, well, why is that? Well, let me tell you what. Let me make a parallel conversation here so you can understand it. It's the same reason, folks, that we have an opioid epidemic in America today where people are taking painkillers and they're dying by the tens of thousands. And doctors who are prescribing these opioid drugs, they either don't know what to do in lieu of prescribing this dangerous class of drugs, which are nothing more than, legal heroin, or they know that if they refer outside their office to, let's say, doctors who can keep them away from these drugs, such as chiropractors and acupuncturists and physical therapists and naturopathic doctors and other doctors who are in the pain game, if they refer them to these people, it's a one-way path. They're going to get better most of the time, and they're not going to come back. So it could be financial. They know about it, but they just don't do it, or they're ignorant to it. The same thing applies here. Either doctors know that the oral cavity is part and parcel of a healthy body, including the cardiovascular system, and they just refuse to refer because if a dentist helps their patient out, they're not coming back. They're going to feel better, and they're probably going to lose a source of income, or they just are ignorant to the fact that this information exists, and if you don't clean up the oral cavity, you're going to have these infections baiting deeper into the system, including the heart. It's one of those two. And we're here today to try to educate people on this, so stick around. We'll be right back with our special guest, Dr. Chris Kammer, on the area of oral health, a very important topic. I'm Dr. Bob Martin. All right, back to our conversation with our special guest, and that is Dr. Chris Kammer. He's a doctor of dental surgery. He is the founding member of the American Academy of Cosmetic Dentistry. Dr. Kammer, by the way, trains dentists all over the world. And I have flown many, many miles to hear his excellent lectures. You may have seen him on the Today Show or the Late Night Show when David Letterman was on. He's been around for at least 20 years and very well respected in the dental profession. He's a man on a mission to help people understand that they can take control of their oral health right there in the privacy of your home by knowing what to do. And let's get back to that conversation with Dr. Kammer. All right, Dr. Kammer, let's get into this a little bit further. People are saying to themselves, okay, so I know that I might have issues related to my oral cavity, and I brush my teeth, I floss. What else can be done in order to contain and control the bacteria, the microbes that, the oral cavity contains and gets out of control that can lead to some of these serious things that are now being discovered and learned about that you're teaching, with whether it be heart attacks or strokes or other problems? How can people get out in front of this and try to prevent this stuff?
Okay, first of all, and I appreciate the question because people don't know what bacteria are living in their mouths because you can't see it with the naked eye. If you don't do a saliva test, you'll never know. And so you need to get to a dentist that'll do a saliva test because some of these particular types of bacteria have been implicated in the actual development of atherosclerosis. So cardiovascular disease has been the number one killer for almost 100 years. And now finally, these bugs that are living in our mouths have been connected to as causative of the development of atherosclerosis. And atherosclerosis leads to heart attack and stroke. So you got to go after these bugs, but you got to know if they're there or not. So you got to get tested. And dentists around the country can do a saliva test on you. Find one. Once you know what's there, then you've got to go and kick them out. You've got to kick them out with the proper therapy. Then there's another part that a lot of people mess up on, and they don't do the proper home care. Now there are strategies for home care that can help make it so much harder for those bugs to live in your mouth. And I recommend that people use a water pick to reach the areas below the gum line that the floss and brush can't reach. I recommend that they use a probiotic. That's an oral-specific probiotic because there's a competitive battle going on in your mouth between the good bacteria and the bad bacteria, just like in your gut. But you want to use an oral probiotic. Xylitol is almost like the miracle natural ingredient that most people aren't aware of, and that actually should be on the cover of every medical journal and dental journal because it also impacts the strep mutans. Those are the first forming bacteria on your teeth that leads to tooth decay, and these strep mutans have also been implicated, and they're finding these strep mutans in the plaques of arteries and such. So it's getting into the circulatory system. It's causing inflammation in the arteries. It's been associated with heart disease as well. So you want to get in there and do the proper home care. Water pick. You want to use the probiotics. I recommend electric brushes. Xylitol. Boy, I get everybody on xylitol. I want mom and dad on xylitol because these diseases are transmissible. If you have bad bacteria in your mouth and you lick off Junior's pacifier because your toddler dropped it on the floor and you quick lick it off, well, you just transferred your bacteria to that pacifier. And if your bacteria is down because you're a regular user of xylitol and probiotics and such, you'll have less chance of passing that on to anybody else. So the home care seems to be the critical component that people could really step up to battle these bacteria that you just can't see with the naked eye. And let me tell you something, folks. Your dentist can't see it with the naked eye. You could have good clinical signs. You could have gums that don't seem to bleed and everything's fine, and every time they're saying you're doing a great job, but you don't know what you can't see. And that's fully one half of the periodontal and oral health diagnosis is this bacteria that's living in your mouth.
Yeah, no question about it. And ignorance is not bliss, folks, when it comes to this topic. Just because you don't see it doesn't mean it doesn't exist. Get to a health food store or a store that sells Spry Dental Defense System. We'll be right back.
Check out Dr. Bob's website. Listen to the show live online. Hear past shows. Read breaking health news and more at drbob.com. Spell out doctor, that's DOCTOR, Bob.com.
All right, and welcome back to this hour of the Dr. Bob Martin Show. Stick around because next hour we have this week's installments of the Health Alternative of the Week, Health Outrage of the Week, and the Health Mystery of the Week, plus a ton of news to share with you. And we'll go to open line health questions from headaches to hemorrhoids, aches to shakes, pimples to prostate problems, and all points in between. Open line health questions next hour. Now, our special guest this segment of the show is Dr. Chris Kammer. He is a founding member of the American Academy of Cosmetic Dentistry. He's been in practice for a couple of decades. He teaches dentists all over the world. He is here with us today, helping us to better understand how important it is to take better care of your oral health beyond just your dental hygienist, which is critical, and seeing your dentist on a regular basis. That's important. And, of course, brushing, flossing, doing whatever else you need to do to optimize dental health, oral health. And one of those things he recommends as a doctor of dental surgery, and more of his colleagues are finally picking up on this, and we hope that other healers and other healing arts, as in mainstream medicine and other healing arts, will understand the value of taking care of the portal of entry into the human body, the oral cavity, as it relates to making sure that we provide excellent exposure to xylitol, as Dr. Kammer pointed out, so that we inhibit this germ-infested area, which is normal and natural, but keep it under control. Unfortunately, it's out of control in most people's lives. They don't know it until it hits critical mass stage. They have bleeding gums. They have all kinds of receding gums. They have all these dental issues. And there it is, the bacteria, and the metabolism of that bacteria spewing out these elements into your mouth and proliferating the risk, driving the risk up for all kinds of preventable diseases, including heart disease and strokes and diabetes and Alzheimer's and you name it, a long list related to inflammation. And the way to control that, as Dr. Kammer has pointed out, is by using xylitol. Now, our favorite here on the Dr. Bob Martin Show is Spry Dental Products. They are the leading xylitol product in the market today. We use them in our family, both the Spry toothpaste, the Spry gum, the mints. They, in fact, have the Spry Dental Defense System. And it's something that you and your family need to become familiar with, and it's quite readily available. Spry Dental products are available at Vitamin Shop, Whole Foods, Sprouts, and other fine health retailers nationwide. You can also find Spry Dental products at Kroger stores nationwide. There's a complete list of retailers where they're at right on their website at Xlear, that's Xlear, the X is for xylitol, xlear.com. All right, now, I did not learn, Dr. Kammer, about biofilm. I did not learn about all these things that I think every doctor should have 101 as part of their microbiology course. It just didn't even exist. I mean, we were talking about exotic things we'll never see in a lifetime in my microbiology course. We should have been talking about the microbes inside the oral cavity, and I think today it needs to be integrated into the education of both dentists, for sure, and doctors in general. What do you say to that?
Well, actually, absolutely. Biofilm. Did you ever see that movie called The Blob with Steve McQueen, where there was this monster from space and it kept growing, getting bigger and bigger? Well, there's this blob that's living in your mouth, and it's this collection of bacteria that groups onto each other, gets stronger by associating with each other, becomes larger and larger, and it's tougher and tougher to get out of there. So to attack this blob, you've got to go in there with everything possible. This biofilm is just a collection of more empowered bad bacteria that are harming your teeth and gums. So you want to get in there and use the products and use the systems to kick it out. And it's hard to kick out. So that's why there's so much discussion about the biofilm. So you want to go in there with every weapon you can. You want to go in there with a water pick. You want to go in there with an electric brush. You want to go in there with the probiotics once again to build up the good bacteria, because they're all competing. The bad bacteria competes with the good bacteria for food. Same thing with xylitol. Xylitol, the amazing thing about xylitol is that, first of all, the bad bacteria, when it eats the xylitol, uses it for a nutrient, it can't metabolize it. It's as if you and I were to eat plastic bags all day. Pretty soon we'd probably die, right? Well, the xylitol has the same effect on the bacteria, this bad bacteria in the mouth. Plus, it attaches to the outside membrane of the bacteria, so they can't stick together. They can't turn into the blob inside your mouth and become more powerful and stronger and more harmful. So xylitol, once again, is just something that it's natural. The name xylitol sometimes makes you think like, well, there must be some chemical they created in the lab. It's not. It's as natural as what they extract it from birch trees and from fruits and vegetables. Our own bodies can make it. It's as natural as that. So you want to get xylitol into your mouth, and it's and you want to get it in there, 5 times a day, because it's not the amount, but it's the exposures, and it makes it pretty hard for the bad bacteria to survive. And so that's a great takeaway from this morning's discussion.
Absolutely, absolutely excellent. Folks, if you're using some of the name brands out there in the market, I'll say it, Crest and Pepsodent, forget about it. Switch over to the one that's packed full of xylitol, Spry Dental Products. And again, finer health food stores and other stores nationwide, or Xlear, Xlear.com. You're listening to the Dr. Bob Martin Show.
My fight so hard, take back my life so hard, prove I'm alright so hard.
Looking for alternatives to risky prescription drugs and surgery? You found it. It's the Dr. Bob Martin Show on the Better Health Network.
All right, and we are back. It's so refreshing to hear from an integrative dental professional who understands that there's more to dentistry than just, fills and drills and stuff like that, cosmetic dentistry. And we'll get back to our finishing comments with Dr. Chris Kammer in just a moment. Speaking of integrative medicine, Dr. Gary Deng, MD, PhD from Memorial Sloan Kettering Cancer Center in New York. I went to a lecture in Japan to hear him. He was the keynote speaker, and he said to hundreds of doctors from all over the United States that oncologists have nutritional knowledge deficiency. And they tell their patients when they come in with cancer, doctor, what do I do? I have cancer. And they say, just keep doing what you're doing already. Just keep eating the same thing. He believes that integrative medicine should be a part of all cancer care. And this is where Sunridge Medical Center comes in, America's premier center for alternative medicine. Sunridge is an alternative medicine treatment center and immune recovery facility that offers advanced, research-based alternative medicines as supportive care to patients suffering from a wide variety of serious illnesses resulting from a compromised immune system. We're talking about cancer. We're talking about autoimmune diseases. There's over 70 of them. Fibromyalgia, chronic fatigue syndrome, Lyme disease, lupus, multiple sclerosis, you name it, they see it, and they do a fantastic job often when conventional medicine fails. But don't believe me or them. Watch their patients talk about their story of illness, treatment, and recovery in their video gallery at sunridgemedical.com, sunridgemedical.com. Or better yet, call them, get a consultation on the phone, see if you qualify to become one of their patients. 800-923-7404. 1-800-923-7404 for Sunridge Medical Center or sunridgemedical.com. All right, we only have about a minute left. I just wanted to ask Dr. Chris Kammer, who's a doctor of dental surgery. He's with us talking about the importance of using xylitol in the form of Spry Dental Defense System, available at health food stores and other fine health stores, about being known as the rockin' dentist, Dr. Kammer. What is that all about?
Wow, what is that? Well, I'm just a big fan of rock music. I sometimes feel like the way to get the message to the people sometimes is to speak it in a language they understand. Sometimes to me that's rock and roll. I've been on the American Idol. I've been followed by TMZ. I've kicked off many a dental meeting, including the American Academy for Oral Systemic Health, of which I'm the founding father, which connects all this together. So I have a good time communicating the message, but it is a message that people need to take as seriously as a heart attack, because that's what it could lead to, and that's sort of at the core of my message. But why not open more doors and make it a little more entertaining and catch people's attention with whether it be rock and roll or a flashy silver suit or a giant toothbrush that shoots confetti and CO2 high into the sky.
I have seen it all, because I've seen you lecture, and not only are you educational but highly entertaining, and I completely appreciate what you do, Dr. Chris Kammer. Thank you for joining us, sir, and have a good rest of the weekend. All right.